full body physical assessment. So enjoy the show. Alright, we're about to start the physical assessment. Our patient Trish is coming in. Hi there, how you doing? Okay, why don't you take a seat there on the table. And we'll take your vital signs. Alright Trish, we're going to start by taking your temperature. We're going to take your temperature orally here. Alright, open your mouth and we'll place this underneath your tongue. Okay. Okay, says you have a temperature of 98. Okay, very good. Alright, now we're going to take your blood pressure. Let me just get my stethoscope here. Why don't you give me your arm here? Replace your palm up. Okay. Now, this one here. Alright. Now what I'm going to do is I'm going to palpate your pulse here. Your radial pulse, and then I'm going to pump this up until I feel it stop. Okay. That way I know when to start looking for the sound of your artery. Okay. Okay. Your blood pressure is 118/62. Alright. Now let's take your pulse. I'm going to look at my watch and take this for 30 seconds. Alright. And now that the 30 seconds are up, I'm not really talking to you right now, but I'm going to watch your chest and see if you're breathing and count your respirations for another 30 seconds, but you don't know this. Okay? Okay? Alright, good, good. Let's write down your findings here. Alright, now can you stand up for me and we're going to take your height and your weight here. Alright, we're going to take this and we're going to wait until it falls. And then we're going to move the smaller one over.
Alright, come on now.
Okay. It won't work that way. Okay. Now we have your weight over here. Okay. I've recorded your weight, and now we're going to take your height. You standing straight? Your head up?
Yeah.
Okay. Alright. 5'5". There we go. Alright, you can step off the scale now. And you can take a seat. Alright, Trish, I'm going to need you to stand up. Step right over there by the scale. Okay. Now, we're going to test your balance with the Romberg test. I need you to close your eyes and stand still for 20 seconds.
Okay.
Okay? Now, it seems that the patient has proper balance. She isn't swaying or anything, and it's been 20 seconds. You can open your eyes now. Okay, now we're going to test your gait. I need you to walk forward, right up next to me, in a normal, easy gait. Okay, good, good. All right, now on the way back, I want you to walk heel to toe. All right. Good. Now, on this way through, I want you to walk on your heels. All right. Proper gait. And then, now I want you to walk on your tippy toes. Alright, the patient has a normal, easy gait. It doesn't seem to be any problems. Okay, now we're going to test your coordination. I want you to place the palms of your hands on your knees, and then I want you to place the backs of your hands on your knees and alternate that and go faster each time.
Okay.
Okay. Good. Alright. Now, I want you to touch your thumb to each finger, and then continue doing that and go faster. Okay, good. Now, I want you to touch my finger and then touch your nose. Yeah. Okay, now I want you to touch that finger. Okay, touch this one. Okay. Alright, good. Now I want you to close your eyes and then touch your finger to your nose, and then touch your other finger to your nose, and then go faster. Yeah, keep going with the...
Okay, go.
Keep alternating
Okay.
with your eyes closed. Yeah, alternate like this. Yeah. It's alright. Okay, that works.
Close enough.
Alright, yeah, patient exhibits proper coordination, is able to do it, everything except for the alternating nose, but that was confusion with my explanation. Okay, now I want you to just slightly bend your knees. Okay, and I want you to just hop a little bit on each knee. This is part of the balance. You're exhibiting proper balance. Now I want you to do a deep knee bend. Just bend your knees. Yeah, that's good. Okay. Now we're going to check your spine. So I want you to touch your toes. Okay. Your back is exhibiting the proper C shape, and I'm going to palpate your vertebrae. Okay. It's in a straight line, and it's not curved. Okay. Alright. Now, your flexion was 70 to 90 degrees, which was proper. And I want you to keep showing me your range of motion. Alright? So I'm going to support you with my hands, and I'm going to want you to tilt back. Alright? Now tilt to the side. Like this. Okay? Yes.
Okay.
And then tilt this way. Okay, now I'm going to want you to turn to your left side, and turn to your right side. Okay? Showing all the proper range of motion for the back. Okay, and that's it. Okay. Now I'm going to have you sit down on the table, and then we're going to continue on to your face and head. Okay, now we're going to inspect your head and your face. Now we're going to start with inspecting your level of consciousness. You seem to be awake, you're alert, and you're responding to my stimuli, me talking to you. I don't have to pinch you or anything. Alright, now we're going to see if you're oriented to date and time. Now, what's today's date?
The 1st, October 1st.
Okay, and what's the day of the week?
Friday.
Friday, okay. What's your name?
Trisha.
Okay, and what county do you live in?
Hopkins.
Hopkins, okay. Very good. You're alert and oriented times 4. Now you're making eye contact with me, and that's proper for your culture. And now we're going to move on to the inspection and palpation of your head. I'm going to check your head, see if you have any lesions, any nodules, or any infestations. Okay? And tell me if there's any tenderness. Okay, I don't see any, I don't feel any nodules. And I don't see any lice. Okay.
Hope not.
Good. Your head is round. It's normal cephalic. It's centered on the neck, and it's a midline in your body, and it's appropriately sized for the size of your body. Now, see your facial symmetry. Each side of your face seems to be properly symmetrical. Each side has all the appropriate parts. Nothing is drooping or hanging. Okay, good. Alright, now I'm going to need you to smile. Alright, and then I need you to frown. Alright, good. Now, close your eye against me trying to open them.
Close them.
Yeah, I'm going to try to open them. Or test a cranial nerve there. Alright, you were able to do that. Now, and they both felt equally strong, which is good. Now, I need you to lift your eyebrows. Okay, good. And I need you to puff your cheeks while I try to squeeze them. Okay, good. Alright, we just tested your cranial nerve 7. Now, I need you to open your jaw and close it for me. Okay. Now, I need you to hold your teeth tightly. Alright, and I'm going to feel for your masseter. Okay. Alright, good. Now I'm going to try to open your mouth. Alright, good. Alright, and that was your cranial nerve 5. Now we're going to test your skin color and temperature. Your skin is pink, which is normal, and your temperature is warm. It's a little warm in here. So that's normal, okay. Now let's check your let's check your temporomandibular joint. Now I'm going to need you to open your mouth, and I'm going to feel your temporomandibular joint. I don't feel any cracking or popping, which is normal, and that's good. And did you feel any tenderness while I was doing that? Okay, good. All right. Now I'm going to check your maxillary and frontal sinuses. Okay. Now when I palpate your sinuses, tell me if there are any tenderness. I'm going to check right below here for the frontal sinuses. Okay, and then I'm going to palpate here to check for your maxillary sinuses. Any tenderness? Okay. If there was tenderness, I would have had to transilluminate them and see if there's any or if there's anything congesting it. Now I'm going to feel your temporal artery. Okay.
Okay.
Palpate your temporal artery. There. Okay. And it's a strong pulse, and so I'll give that a +2 on the scale. Alright. Everything seems good. Alright, Trish, now we're going to check your eyes. I'm going to need you to stand up over there by the door. We're just going to say that it's 20 feet away from the chart. Okay, the chart is over here. Okay. And I'm going to guide you through this to see your vision. Okay? Now I want you to cover your left eye. Okay, you can use this right here. Cover your left eye, and I want you to read the lowest line.
Okay. PEZOLCFTD.
Okay. Let me mark that down. Okay, that one says 20 out of 10, and you didn't miss any, so I would write down 20, 10 for your
Vision.
okay, for your vision on that eye. Okay, and then the next eye, we're going to do that one. Okay.
FDPLTCEO.
Okay. Now that one said 20 at over 13, and you didn't miss any, so I would put 20 over 13. Okay. Now we're going to test your confrontation. Alright, so we're both going to cover this eye here, and I'm going to move my finger from the outside, and you're going to tell me when you see it, okay?
Okay.
Alright. Now the next eye. Okay. Alright, good. Alright, you have proper confrontation, and your vision was a 20 out of 20, or 20 over 10, and 20 over 13. Okay, now we're going to check your pupils and take a look at them. They're both 3 centimeters. Okay, they're both symmetrical and they're the same, and they're both round in both eyes. Now, what I'm going to do is I'm going to check your not your accommodation, but your consensual reflex and your direct. Okay, so I'm going to bring in this light and I'm going to see if your pupils constrict. Okay, so this one constricted, that was direct, and then the other eye constricted too, so that was consensual. Okay, and I'm going to do it from here too. Okay, and it was the same on the other side. Now, what I'm going to do next is I'm going to test your accommodation. Now, I want you to stare at that point in the wall on the far end. Okay, and then now I want you to stare at this. Okay. Now your eyes, your pupils opened up when you were looking at that, and then they narrowed again when you looked at this, which shows proper accommodation. Now, what I'm going to do next is I'm going to test to see your ocular eye movements. Okay? So I'm going to go in the 6 cardinal directions, and I want you to follow this pen. Okay, up that way. Next one. Okay. Okay. Alright, good. You're showing proper extraocular eye movements. Okay, now we're going to look at the physical characteristics of your eyes. Your eyeballs are not protruding or sunken. Your eyebrows are both symmetrical bilaterally, and the distribution of hair in your eyebrows is even. It's not splotchy or anything like that. Okay, and then your eyelids meet with the bottom. The top of your eyelids meet with the bottom of your eyelids. You know, the top ones meet with the bottoms. Okay, and I'm going to look at your conjunctiva, and they're clear. And your sclera also is clear. It's not yellow or anything. There are no discharges coming from your eye, and I don't see any lesions. Okay? Now, next I'm going to check your corneal reflex. Okay, so I want you to look straight ahead, and I'm going to shine its light, and I'm going to look for the reflection of the light in the same place in each eye. And they are in the same place. So you have proper corneal reflex. Okay? And let's take a look at your iris. I'm going to look from the side, and I'm going to see if it's round and it's not depressed or anything like that. And yep, it is. Alright, there we go. Okay, now we're going to take a look at your eyes. We're going to look at the inside of your eyes. I'm going to dim the lights. Right here. It's pretty dim. Alright, now let's take a look here. Okay. Now I'm going to look for the reflex here. Okay. There we go. I see the light reflex, and I can also see your arteries, and as well as the optic disc. It looks normal there. Let's take a look at your other eye. Okay, good. They all look very normal. Alright. Okay, now we're going to inspect your ears and take a look at your ears, see if there are any lesions or if there are any discharges. Okay, and you seem to be normal here. And I'm going to see if they're both symmetrical on each side. And yes, they're both sitting on the same line, and they don't sit low, you know, because it's supposed to follow the line of the eyes. Okay? Now I'm going to take a look inside your ear. Okay? Just to see if there's any light. Let's get a new thing on here. Okay? Now, since you're an adult, I'm going to pull up and back on your pinna. And I'm going to observe your ear canal and see. Okay, there aren't any lesions or anything, any breaks in the skin or discharge inside here. And now I'm going to look at your, tympanic membrane. I can see the light reflex. Okay. Alright, let's take a look at the other side. You can turn your head so I don't have to.
Yeah.
Okay. Alright, no discharge in the canal, it seems normal. And I can see your light reflex. Alright, there we go. And your tympanic membrane's in good shape. Okay.
Yeah, I'm okay.
Okay. Alright, now with my tuning fork, we're going to do the whisper test. Alright? Now I'm going to need you to press on your tragus here on the opposite ear and press in and out while I whisper something, okay? You're going to tell me what I whispered.
Fire truck.
Okay. I'm going to whisper again.
Zip line.
Okay, good. Alright, now I'm going to do the Rinny test. Now, tell me when you hear the sound. You hearing anything? Okay. Let's try again.
Yeah, I hear it.
Oh, you hear it?
Yeah.
Okay. Now, is it any louder on either side?
Mm-mm.
Okay, good. So the sound did not lateralize, which is normal. Okay. Now I'm going to place this here on the bone behind your ear and tell me how long the sound lasts, okay?
Okay.
And I'm going to time that.
Okay.
Okay? Now tell me how long this lasts.
Okay.
Okay. That was roughly twice as long. When the bone conduction lasted half as long as the air conduction. And tell me when you stop hearing.
Okay. Okay.
Alright? Alright, good. That was normal. Okay, now I'm going to take a look at your nose. I'm going to check the external features. It's symmetrical, it's straight down the middle. Okay, and your nares, they seem to be working fine. I'm looking for lesions, and I don't see any lesions. Okay, good. And I don't see any discharge coming. Now I'm going to take a look at the inside of your nose. Okay?
Okay.
Take a look. Now, your mucosa is pink.
Okay.
Okay, and I can see the superior nair, or not the nair, I'm sorry, the turbinate.
Sorry.
It's alright. You can see the turbinate, and there wasn't any swelling or anything. Okay, look at the other side. The mucosa is also pink, and yeah, I can see the turbinate too.
Yeah.
And you seem to be doing fine. Okay, now I'm going to test the patency for each nostril. Okay, now I want you to close your eyes, and
Okay.
I'm going to cover up this nostril,
Okay.
and I need you to take a whiff and tell me what this is.
Coffee.
Coffee. Okay. Next one. Tell me if you can.
Yeah.
Yeah? Okay, good. Okay, now we're going to inspect your mouth and take a look there. Okay. We're going to take a look at your gums. I'm going to bring this down.
Okay.
Alright, they're pink, they're not bleeding, or there's no discharge, they're not red. Okay, now I'm going to check your buccal mucosa. Oh, sorry. They're pink and they're lightly stippled. My nose is itching. Okay, alright. That's the same on the other side. Okay, now I'm going to need you to raise your tongue to the roof of your mouth, and I can see the veins and the saliva, okay, which is good. Now I'm going to take a look at your upper palate, your hard palate, okay, and it's ridged, and it's pink, and then your soft palate as well. Okay, now I'm going to need you to open your mouth and say ah.
Ah.
Okay, and I can see your uvula as well as your tonsils. Yeah, there we go. I can see your tonsils. They're not inflamed or anything, and they're not really small, so they're a +2. Okay. Alright, now I'm going to count your teeth. Open up your mouth. Alright, I see 15 on the bottom. Okay, you have 32 teeth. Alright, now I'm going to need you to stick out your tongue. Alright, good. Alright, bring it back in. And open your mouth. Alright, it's in midline. Okay, now I need you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, good. Now open your mouth, and I'm going to open it wide.
Okay.
And I'm going to test your gag reflex. Okay.
Okay.
Alright, good. Okay, now I'm going to inspect your neck.
Okay.
Alright, I'm going to take a look at it, see if it's midline on the shoulders. Okay, and I'm looking for lesions. I don't see any lesions. Okay, and I'm going to palpate your trachea right here. Okay. Alright, now I'm going to have you take a drink of water here. And I'm going to shine the light on the side. Check for your thyroid gland.
Okay, you ready?
Yeah. Okay. There was no swelling and it was moving up and down. I can feel it. Okay, now... okay, there weren't any masses on your neck either. Now, we're going to look at all your lymph nodes. Okay? Your preauriculars are here. They're not swollen. Okay, and then this is your jugulo-digastric. Here, they're not swollen. Your submandibular, and then your submental, right up here. Okay, your superficial cervical over here, and then your preauricular over here behind your ear. Your occipital, which is back here behind the head. Okay, and then you've got the deep cervical over here, and then your supraclavicular right over here, and then your post cervical or posterior cervical lymph nodes right here, and none of them were swollen, which is pretty good. Okay. All right. Now I'm going to take a look at your carotid pulse. Okay. It's pretty strong. That's a +2. Okay. Now we're going to test your range of motion. I'm going to need you to bring your head forward. Okay. Now bring it back. Okay. Now I'm going to take it to the side and then to the other side. Now I'm going to need you to touch your ear to your shoulder, and ear to the other shoulder. Okay, now I'm going to need you to shrug your shoulders only. Okay, now you're going to shrug shoulders against my pushing. Okay. Now you're going to bring your head side to side against my pushing. Okay. Alright, good. And then forward and back. Okay. Good. You've got good range of motion. And okay, now we're going to we're going to look at your thoracic cage. Okay. Now I'm going to check your spinous process and make sure it's straight. And yes, it is. Okay, and your scapulae are both symmetrical. I'm going to check your turgor by pinching some skin and letting go. And your mobility is fine. It was able to go back within 3 seconds. Okay, you have an elliptical thoracic cage, and your ribs are sloping down. Okay, I'm going to check for tactile fremitus. Okay, I need you to say 99.
99.
Okay. Say 99.
99.
Okay. Say
99.
Okay.
99.
Okay. I need you to say 99.
99.
Okay. I need you to say 99.
99.
Okay. And let's see. Alright, now we're going to check your shoulders to see if they're all if the muscles have atrophied or anything, and whether or not they're symmetrical. Okay, now I'm also going to test to see if your rib cage rises equally on both sides. I need you to take a deep breath. Okay, good, good. You better hurry. Okay, now I'm going to check for masses and tenderness. I'm going to check the entire back and palpate the whole way through. Okay, do you feel any tenderness? No?
No.
Okay. Also taking a look at your spinous process here. Okay, good. There weren't any masses. We already checked your chest, and I'm going to take a look at your skin color, and it's normal for your, it's kind of pink, and it's normal for your background. Alright, good. And now we're going to move on. Alright, now we're going to percuss your lungs. Alright. We're looking for a resonance here. Okay. And we're going to move in between the shoulder blades. Alright, and then move to the other side. Move down. Still between the shoulder blades, switching sides. Okay. Okay. down to the bottom of the lungs. Okay. Okay. I could feel it. Okay, now I've got my pen here. Now I'm going to need you to exhale and hold your breath. Okay?
Hang on. Okay. I'm exhaling.
Okay. I'm going to percuss until I feel it go dull. And that's where I'm going to draw on your skin. Okay?
Okay.
Alright. Now I've drawn the line. Now I need you to inhale and hold your breath. Now I'm going to percuss until it becomes dull. Okay? And then I'm drawing the line there where the next mark is.
Okay.
You can release. Alright? And that is the diaphragmatic excursion. Alright? Okay, now I'm going to auscultate your lungs. We're going to use the same positions that I used for the palpations. Okay, I need you to take a deep breath. Okay. Take a deep breath. Okay, your sounds are audible and they're not diminished. Take a deep breath. Okay, another one. Okay. Okay. Next one. Alright. Okay, and this is directly on the skin. Okay, next one. Alright. Okay. 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 Alright. Very good. Okay. Now I'm going to listen to your heart. I'm going to be looking in these different places here. I'm going to be looking at your aortic, right? And then your pulmonic over here. And then your herbs point right here. And then right over here is going to be your tricuspid. And this is going to be your mitral, okay? So I'm going to take a listen. And I'm going to look for murmurs, or not murmurs, I'm just going to listen for your sounds, your S1 and your S2. Okay, so this is going to be your aortic, this is your pulmonic, this is your herbs, right here, and then right here in the middle is going to be your tricuspid, and then down here is going to be your mitral, okay? And then I'm going to use the bell of my stethoscope to listen for the other sounds, the murmurs and all the other good sounds. And I'm going to place it lightly against the skin. And the same places. Here, here, herbs point, and then tricuspid, and then mitral. Okay? Okay. Now we're going to take a look at your apical rate. And I'm going to count that for 1 minute. Down there. Okay? Ready? Okay, good. It was regular and it was steady. Alright. And that's about it for the heart. Okay, now we're going to do the breast exam. And sitting down, now I'm going to need you to raise your arms up over your head. And I'm going to look to see the mobility of your breasts. I'm checking for symmetry, and they're symmetrical in the size and the shape. And also underneath the breasts as to whether any masses are there moving, or moving irregularly or anything. Now, place your hands on your waist, and I'm checking to see the movement there again, and also lumps and masses. Now, place it right here like that. Good. Okay, and yeah, the same thing. No masses or anything moving. All right, now place your hands down again, and I'm going to palpate. Now I'm going to start from the nipple, and I'm going to use the pads of 3 fingers, and I'm going to move around in a spiral pattern, making sure not to miss any single spots. And also to include the tail of Spence, which goes up to there, from the breast up to the axillary area. Now, if I find any masses, I'm going to note the size and the position within the quadrants in relation to the nipple, and that's it. Okay, now I'm going to need you to raise your arm up and place your hand on my shoulder, and I'm going to support your arm, and I'm going to check for the lymph nodes here. Now, the central ones are going to be here in the axillary area. The laterals are going to be up here, and then the pectorals are going to be over here, and then the subscapulary are going to be right over here in the back. Okay, and they form a little box right in there. Okay, now when you're doing a self-breast examination, you're going to want to do it once a month, and you're going to need to connect it with something you do once a month, like paying your bills or your period. And you should do it in the shower because the lather helps you detect lumps or anything. And the more often you do it, the more likely you're going to catch any irregularities. Now you're going to do exactly the same thing I did. And you can use any pattern you like spokes on a wheel or in a spiral pattern, right? And that's it. If you know anything, let the doctor know. Okay, now I'm going to need you to lay back. I'm going to put this pillow behind you, and I'm going to need you to raise your right arm over your head. You can leave the left one. And we're going to palpate again. This lets the breast sit more evenly on the chest, and we're going to do the same exact thing. You know, tail spans, and then I'm going to need you to do the other side. Okay. All right. Okay. Good. And that's it. Okay. Also, while you're inspecting, I'm going to inspect the supraclavicular area and the infraclavicular area to notice for any changes in skin color. Also, when I'm doing a breast exam, when you're doing a breast exam, you would milk the nipples and note any discharge, especially if you're not pregnant or anything like that. Okay. And also, I would be checking the size, the shape, and the symmetry of your areolas, as well as the nipples, whether they're pointing in any strange directions or if they're inverted, anything like that. Okay. Okay, for the male breast examination, I would check the entire area like I would for a female, check for any lumps or hardness, and check for the nipple area to see if there are any masses there as well. And then also I would check for hair distribution and any discharge in the nipples. Okay, now we're going to inspect your upper extremities. Alright, good. We're looking for symmetry in the arms here. There, and each of the muscles. Okay, good. And the skin temperature. It's a little cooler than the rest of the body, especially out here, but it's warm. Okay, and color is the same. Alright, good. You can also check turgor. Alright, good. Okay, now, we're going to test your range of motion. Okay? Now I'm going to need you to move your palm in and out. Okay, good. And we're going to need you to flex your elbow. Okay. And I need you to abduct your arm and then adduct your arm. Good. Okay, I need you to bring it up and bring it down. Okay, and bring your hand down, bring it up. Now take each finger with your thumb and, opposition. Okay, now I need you to separate your fingers like this, and then close them. Okay, and then make a fist. Okay, good. Same thing with the other arm. Okay, and then, okay, in and out. Fist. Okay, in and out. Okay, and then bring it down, bring it up. Okay, and the elbow. Okay, also bring it out like that. Good. Now abduct your arm. Up. Okay, and then up and down. All right. Good. Very good. Now we're going to test your reflexes. Okay. Now we're going to start with the biceps reflex. I need you to rest your arm on mine, and like that. And then I'm going to put my thumb right here on the biceps tendon, and then I'm going to strike it with the hammer. Okay, good. Now we're going to test your triceps. You're going to hang your arm, and then I'm going to strike it. Okay. All right. Now we're going to do the brachioradialis reflex, which is I'm going to hold your thumb like this, and then I'm going to tap it. Okay, good. Okay, now I'm going to test your senses. First I'm going to start with my touch. Okay. Now I'm going to apply this cotton to your hand. Did you feel that?
Yeah.
Okay. Now I'm going to apply a sharp pain by poking it. Feel that? Okay. Good. And now I'm going to test vibration with this tuning fork. And I'm going to apply it to a bony process of your fingers. Do you feel that? Okay. We're going to repeat the process on this side. Light touch. Okay. I'm going to try poking the device. I will poke you.
Yeah.
Okay. Now it's time to test vibration.
Yep. Yep.
Alright, good. Alright, let's check your pulses. Start with your brachial pulse on this side. Okay, it's strong. We got a +2. Now let's start with your radial pulse here. It's also a +2. Now let's see if they're both equal on your side. Okay. And then on this side. Okay, +2. They're equal on each side. Now I'm going to check your epitrochlear nodes, which is right in here. Okay, I can't really palpate them, so they're good. Alright. And that's it. Okay, now I'm going to have you lie down on your back, and I'm going to assess your abdomen. Alright, now we're going to check the contour here. Alright, and I'm going to shine a light over it and stoop down, and I can see that it's round. There's symmetry, and the skin color is even. There are no rashes or lesions, which is good. And now I'm gonna check your umbilicus and see if it's midline, and check for any pulsation. I'm gonna check to see if your umbilicus is oozing anything, any lesions, or whether it's changed from an outie to an innie. It's an innie. Okay, and seems good. Alright, now I'm going to listen for the vowel sounds. I'll also take those, and I'm going to start in the lower right quadrant, because that's where it starts. Okay, and then I'll start there, and then I'll move up. Wait, lower right quadrant. Start there, and then I'll move up, and then move over to the top left, and then move down. Okay, and you've got vowel sounds, and it's normal. Okay, good. I'm going to put this away. Alright. Now I'm going to check to see your liver span, which should be at the right upper quadrant. Okay, so I'm gonna have you take a deep breath, okay, and I'm going to feel a firm ridge here in many cases, but I don't feel anything, but that's normal. Okay, and then we're gonna look for your kidneys, so we're gonna do a ductal position around each side, and I'm gonna press firmly, and I'm gonna have you take a deep breath here. And I'm supposed to feel them right there. Good, good. Now we're gonna do your spleen, which is on the left side, up here in the upper left quadrant, okay? And which is right there. Okay, good. For your liver, I'm going to start with the lung resonance, and then I'm going to keep going down until I hear a dull sound, and I'm going to mark that with my pen. And then I'll find the abdominal tympani, and then I'll just keep going until I find the dull sound again. And then that area, which should be 6 to 12 inches, is going to be the span of the liver. Now on the other side, okay, we're going to do the gallbladder, and that's going to be mid-axillary line down, and I'm just going to palpate until I find a small circular area. Okay? Good? Alright, now I'm going to do your abdominal reflexes. I'm going to just go on the side here, and this is all skin. I'm going to stroke from the inside. I'm supposed to see your abdominal muscles kind of contract there. Okay, this was the upper, and then here was the lower. You're supposed to see your umbilicus kind of twitch. Okay, and your femoral pulse is right over here. I'm going to palpate that and feel if it's a number 2 or a 3 or a 1, and it's a number 2. And then if you were a male, the cremasteric reflex is where you take a tongue blade and you stroke the inner area of the groin, and then the testicles are supposed to retract a little bit. Okay, and then after that, I would be palpating the inguinal nodes, which are deep in the groin, and I would bring up my fingers deep inside there and try to palpate those if they're swollen or not. Right? Okay. Now I'm going to check your lower extremities. I'm gonna note any symmetry or any asymmetry, hair distribution, and varicose veins, and any lesions, rashes, anything like that. And now I'm going to palpate your pulses. Here's your popliteal pulse. I'm gonna hold the artery against the bone up here behind the knee. Okay, and I'll note that as a +2. And then your posterior tibialis, which is right here under the ankle, I'm going to note that as a 2. And then the dorsalis pedis, which is above the foot, and I'll note that as a +2 as well. Okay, I'm also going to note the spaces between the toes, and I'm going to palpate in between to see if there's any irritation or any lesions on there, and any tenderness. Alright, now we're going to test the range of motion. We're going to start from the bottom and we're going to move up. Now I'm going to have you bring your toes out like this and then put them back in. Okay, I'm going to want you to curl your toes. Okay, now I'm going to want you to bring your toes up toward the nose and then bring them toward the floor. Okay, now I'm going to have you do that against pressure. Bring them up. Okay, now bring them to the floor. Okay, good. Now I'm going to need you to turn your foot in, turn your foot out, turn it in like this. Yeah, and then turn it out. Okay, good. You need to do the same on the outside, on the other side. Out, and then back in, and then curl your toes. Okay. Now I'm going to need you to bring it up toward the nose, down to the floor. Okay, against pressure, up to the nose. Okay, down to the floor. Okay, bring it in, bring it out. Okay, and then twist it out, and twist it in. Okay, good. Okay, now we're going to move up from the feet up to the rest of the legs. I'm going to need you to lie down. Pull the table up. Okay, good. Alright. Okay, now we're going to test the knees. I'm going to have you flex your knee. Alright. Very good. Flex the other knee. Alright, good. Now I need you to abduct this leg, bring it out, and abduct in. Okay, the other leg, abduct in. Okay, now I'm going to need you to take your toe and point and bring it down, and bring it in, out, and in. Okay, now can you turn on your side for me? Okay, hyperextend this one here. Good, good. And then extend out. Very good. Turn on the other side. Okay. Hyperextend. And then extend. Alright, very good. Bring that back down. Alright. Now we're going to test your reflexes. I'm going to start by testing your Achilles reflex. I'm going to have this rotated externally, and then I'm going to tap your Achilles tendon here while holding your foot, and then it should be going like that. And then I'm going to do your plantar reflex by taking a tongue blade and stroking the bottom of your plantar area, and so that your your foot will dorsiflex. And then the next one, I'm going to have you sit up real quick. And have your feet angled, and then I'm going to hit you right here and test your quadriceps reflex. Okay, good. Now I'm also going to do your sensory, just like I did with the other ones. I'm going to move your lie back down again, I guess. Or yeah, sit up is fine. Okay. Now I'm going to touch your extremities with the light touch. Okay. And then the superficial pain.
Yeah.
Okay. And then the vibration against the bone here. Yeah? No?
Yeah.
Okay, now you feel it. Good. Alright. And then the same thing on this side. Light touch.
Yeah.
Okay. Superficial pain. Poke.
Yeah.
Okay. Now, vibration. Which is there.
Yeah.
Okay, good. Very good. Okay, when you are examining the male penis, the penis is supposed to be wrinkled, and it's supposed to be hairless, and the gland is supposed to be smooth, and the urethra is supposed to be midline. Now, when you get down to the scrotum will be wrinkled, and when you palpate, the testicles will actually be somewhat firm and round, and it's supposed to be the texture of a hard-boiled egg. You're supposed to transilluminate, and then lift it up and check the posterior. And it's supposed to have hair, of course. And when you're doing a self-testicular exam, you're supposed to remember that you're supposed to do it once a month and in the shower, as well as just note any changes. And that's it. Okay, now when you're inspecting the anal area, you're going to look to see that the skin is a little bit coarser and it's going to have folds in it. Now you're going to spread the buttocks open so that you can inspect the actual rectum, and note that if there are any lesions or discharge, and you're going to take your finger inside and push past the sphincter and note the muscularity of the ring and palpate all around, and use a bidigital palpation with your thumb pressing against it. And then you're going to push the finger deeper and note the muscular walls of the rectum, the rectal walls, and it should be smooth and even without any nodularity all across. And then from there you're going to check the prostate, which should feel round, and you're going to check the entire prostate and note the size and see for any changes. And that should be it. Just like with the anal and the male genitalia exam, make sure you wear gloves. Now we're going to move on to the female genitalia. With the female genitalia, make sure to inspect the labia, the labia major, and see if there's symmetry, and note the hair distribution all around. It should be triangular facing down, kind of like a bikini. So yeah, and then note any lesions or discharge. Note the clitoris for any abnormal signs of any sort, and as well as the perianal area, which will have an increase in pigmentation. And that should be it.